The cornea is the most external lens in the eye. Along with the crystalline lens, it projects the images of the outside world onto the retina. The cornea is a transparent dome, and its structural integrity relies on finely interleaved collagen fibers. The regular shape of the cornea is, therefore, the result of its biomechanical rigidity. However, the cornea is not a piece of plastic, and different corneas may respond differently to mechanical stimuli. In several pathologies, such as keratoconus, the cornea weakens locally, resulting in corneal bulging and vision distortion. Keratoconus affects 1% of the population, and treatment requires implanting a supporting structure inside the cornea, intracorneal ring segments, or stiffening the cornea, instilling a dye and irradiating with light, a technique called cross-linking. There are other ocular conditions in which the cornea is reshaped or surgically open. These conditions are highly prevalent, such as myopia, that affects 30% of the population in Western countries and 90% in some Asian populations. Presbyopia, the age-related loss of dynamic focusing capacity, which affects 100% of people older than 45. And cataract, the loss of transparency, which affects 50% of the population older than 65. In corneal refractive surgery, used to correct eyes' refractive errors, a laser is used to sculpt the cornea into a different shape. Alternatively, new techniques are being developed where biomaterials or tissue is implanted in the cornea to correct presbyopia. In cataract surgery, an intraocular lens is implanted through an incision that needs to be made in the cornea. While all these treatments rely to a larger or lesser extent on the mechanical response of the cornea, today there is no clinical instrument that either detects corneal mechanical abnormalities or can help in predicting the mechanical response to surgery. IMCUSTOMEYE, a project funded by the European Commission Horizon 2020 program, addresses this unmet medical need. IMCUSTOMEYE has gathered a reputed multidisciplinary group of experts in academia, industry and clinic to deliver and demonstrate a new clinical instrument which will put Europe in the forefront of personalized diagnostics in ophthalmology. The partners of this highly international consortium are Project Coordinator, VO Lab at the National Research Council, a pioneer group in optical imaging eye diagnostics. Academic partners, Polish Academy of Sciences and the National University of Ireland Galway, both world leaders in biomedical optics and photonics, and University of Liverpool, experts in corneal biomechanics. Two Eyes Vision, Oculus, Optimize and iRock Science, all international companies selected for their unique technical expertise in the ophthalmic industry and strategic position in the field. World most prestigious ophthalmology clinics, Moorfields Eye Hospital and Instituto Oftalmológico Fernández Vega, both with flows of thousands of patients per day. The multidisciplinarity of the consortium will ensure an efficient translation of the front-end laboratory designs and prototypes into a viable instrument that will be tested in pilot clinical studies with patients. IMCUSTOMEYE, bringing light-based technologies to improved diagnostics and personalized surgery.